is John Daniel, BSc Medical Radiography, University of Nigeria. Thank you.
Okay, today we want to talk about ultrasound scan. We want our audience to know more about ultrasound scan. So please can you tell us what ultrasound scan is all about?
All right. Ultrasonography or ultrasound scan, as some people know it, is an imaging modality that uses sound wave. All right. We are looking at sound wave in very high frequency, a frequency that is very high, higher than is audible to the human ear. Right, so it uses transducers and then sound wave being reflected, pushed into the body, and then the reflection of this wave, the velocity through which it is reflected, is now measured, and it is this interaction between the body and the sound wave that you see on an ultrasound monitor, which once you an ultrasonographer can easily read and then evaluate and then give a result as a result of what's the interaction with sound wave with the
Okay.
body.
Okay, we know there is another way of checking the imaging or the image of human body using something like X-ray.
Yeah.
Can you please tell us the difference between ultrasound and X-ray?
Alright, apart from ultrasound, there are a lot of imaging modalities. You have MRI, you have CT, you have X-ray, you have nuclear imaging, there are a lot of them. Okay, and ultrasound happens to be one of them. Now, one of the difference between ultrasound and say X-ray, for example, is the fact that X-ray uses ionizing radiation, right? Makes use of radiation, ionizing, whereas ultrasound, as I said earlier, use sound wave. Up till now, the whether ultrasound is harmful or not has not been established. But from the current information we have, ultrasound is entirely safe, and it does not use radiation. So it is safe for the patient, it is safe for the ultrasonographer, it is safe for those within the environment where ultrasound is being carried out.
Okay. Please can you tell us how or exactly how this ultrasound works?
As I said earlier, basically ultrasound use sound wave, all right, and it makes use of the transducer or probe, as it is called. You see, there are different types of probes. This is the curvilinear, this is a linear, this is the TVS or transvaginal probes. Okay, also called transducers. Right, they use within them some piezoelectric substances, right, which generates or transmits sound information, right, sound wave. And now this sound wave, once these probes are placed on the part of the body that needs to be imaged, you also need a gel. You need a gel, an ultrasound gel. Now the reason for this gel is to make sure that there is no air gap. That air gap barrier is breached by this, right? Because once there is an air gap between the probe and then the surface, you begin to have what is called artifact, and then it becomes very difficult for you to image that part of the body, right? So what you do is you apply a gel, and then this gel knocks out the air gap, and then the transducer or the probe is now in direct contact with that surface of the body, and as it's in contact with that surface of the body, it produces sound wave. Now the wave goes into the body, interacts with the organ that's the surrounding organs there, and then there are sometimes you get absorption. Some wave are absorbed, some others are reflected, and some others are diffracted. Okay, the properties of wave. All right, now those that are reflected back is now those waves are reflected are now taken up by the transducer or the probe, and then the information, alright, as a result of the reflection will now be interpreted by the ultrasound machine, and then one will be able to view it on the ultrasound monitor. The physics and basic engineering that it has to do with the imaging may not really be very important at this moment. But what we need to know is that basic operation of ultrasound involve the use of sound wave that interacts with the body organ, and then it is picked up again by the transducer, and then the image is now being interpreted on the monitor. Right.
Okay, so how do one prepare for this ultrasound scan?
Right, preparation of ultrasound examinations are not very elaborate. Okay, you do not need so much preparations as you have in maybe other imaging modalities, like say when you're going to do special examinations in X-ray, fluoroscopy, for example. In ultrasound examinations, the only preparation you may really be requested to do is for example, if you intend to view the pelvic region, right, there will be need for the patient to come in with full bladder, right? There's a need for that, and then in other cases, you may require the patient to come fasting, right? But basically, ultrasound preparations are not that elaborate. Okay, patient can just ultrasound examinations are examination that you can just walk in and get tested and you go.
Okay, so can you tell us the different kinds of ultrasound scans and what each of them is all about?
All right. If you talk about the types of scans, right, the ultrasound examinations that can be done, if I understand. There are different examinations that we can do on ultrasound, right? We can do, there's the abdominal pelvic examination or the abdominal examination, abdominal scan. There's the pelvic scan, there's the obstetric scan, right? There's prostate scan, right, for the male. There's the transvaginal scan, right? There's also vascular scans, okay? So breast scan also. These are some of the examinations that we can do, or some types of ultrasound examinations that we have, right? There are others, okay, but these are just a few of the very common ones that you get around.
Okay, we want to know, can we still use ultrasound to do the same tests that we use X-ray for?
Okay, X-ray, that is the X-ray and ultrasound. In imaging, the modalities are complementary. When I say complementary, what I'm trying to say is that they support themselves. Okay, there are some examinations that you can do with X-ray that you'll not be able to do with ultrasound. Okay, and there are some ultrasound examination that X-ray will not do very well. Okay, for example, now let's say you want to do, of course you can't do chest X-ray with ultrasound, okay, because of the bony structure around the thoracic region. Okay, what you're going to have is shadowing. The rib cage, you are going to cast shadowing, and it's going to make it very difficult for you to study the organs there, right? But then you can do chest examination with X-ray, right? Now, ultrasound examinations, for if we are going to do obstetrical examination now, it is not advised for you to do X-ray on a pregnant woman. Why? Because of the radiation. Okay, so if you are going to monitor the baby, what you need is an ultrasound examination. Of course, even without the radiation, you can't really monitor a baby using X-ray, because you can't monitor a fetus, right? A pregnant woman with the fetus of a pregnant woman with the X-ray. Ultrasound is the best modality for that. Okay, so these examinations are different, but they are complementary. They complement themselves.
Okay, so what are the commonest ultrasound scans? that people usually come for?
Oh, the most common, I'll say, will be obstetrics. Okay, that will be the most common. Then you have pelvic examinations, abdominal scans. These are the most common ultrasound examinations that you see. Then you can now have breast examinations. Okay, but with the presence of mammography, more persons are beginning to move towards the use of mammography in breast examination. But then, ultrasound is always the first call, the first point of call if you are going to do a breast examination before you move on to mammography. So, the most common of these examinations are the obstetrics, because of course you have pregnant women and every day people give birth to kids. So, obstetrics is the number one, and then you have pelvic and then abdominal examinations. They are the most common.
Okay. So we want to know what parts of the body can one actually observe using ultrasound?
A lot of basically when you want to ultrasound examinations are done basically in the part of the body where you are sure that you will not really be having so much of shadowing as a result of bony structures. Alright. Now, the abdomen can be done, can be viewed with ultrasound. The pelvic region, the breast also. These are basic places that you can do ultrasound examinations on. Alright, but beyond these places, there are also some ultrasound examinations that involve the imaging of musculature or muscles, right? Especially in cases where you have inflammatory conditions, right, or varicose in this part of the body. Okay, when you have varicose, inflammatory conditions, you can also use ultrasound examination to image these organs, right? But basically, when you talk of ultrasound examination, we are looking at the abdomen, we're looking at the pelvic region, we're looking at the breast for the female patients.
Okay, thank you for that. We have seen a situation where patients are asked to drink plenty of water before coming for ultrasound scan.
Yeah.
Can you please tell us why they are asked to drink water?
Alright, patients that are asked to take water are basically the female patients, right, or maybe the male patient. When you're looking at doing the pelvic examination, you need to have a full bladder, whether it's a male or a female patient. Now the reason is because if you go down to the pelvic region, the organs there, the structures there are almost homogeneous in their echogenicity, right? So you need an acoustic window, and the bladder, when it's full, serves that purpose. Okay, so because when the bladder gets full, the water or the urine, the fluid within the bladder, gives a dark shadowing. Right, it is dark compared to the other structures that are there. So once you are able to localize the bladder as a result of the darkening that appears within it, then you can now easily differentiate the bladder from the uterus if it's a woman, or maybe the prostate, or other structures, maybe mass or anything that you want to study within the pelvic region. So basically, it is for this acoustic differentiation or acoustic windowing that a full bladder gives. This is basically the reason that some patients are asked to take water and get full bladder before the examination is done.
Okay. Sir, we have a particular scan test we call TVS,
Yes.
and we know that in that TVS, patients are there's a probe that is inserted into the woman's private parts. So we want to know if this test is not painful and if there is any risk associated with doing this kind of scan tests.
All right. The TVS or the transvaginal examination makes use of the transvaginal probe. This is a probe, right, that is used in imaging a woman that's a lady. Now, with this probe, what is actually done is that the probe is inserted per vagina. It is inserted through the lady's vagina. Now, before you do this, you first need to apply the gel on it, and then there's a need to cover the probe with a membrane, okay, sterile membrane. All right. Now, if you don't have, sometimes in some centers, what they use is a condom, right? So you put your gel on it, and then if you don't have a sterile membrane that you can use, then you can use the condom. Just run the condom through the probe, right, and then you insert it into the woman's vagina. Now, it's of course it's not that painful, okay, but it can be inconveniencing to the woman, right? So it's not painful, but it's just that inconvenience that the lady may feel as the probe goes into the vagina. But once it's inside, then there's no so much of a problem anymore. It's not painful, it's just a little inconveniencing. And a transvaginal probe or transvaginal examinations are very, very, very important and very good, because now it is with the transvaginal probe, the clarity of images that you get are higher, the resolution higher than you would get with a transabdominal probe. Why? Because you are going directly into the female anatomy, and with that, you can easily see what is within. Right. Now, with a transabdominal probe like this one, you may not be able to see a fetus at an early stage of say 4 weeks, right? But with a transvaginal probe, within the 4.5 week, 4 weeks, 4.5 week, a transvaginal probe will be able to pick a growing embryo within the woman, right? So you now begin to see some of the importance of the transvaginal probe. So it's not painful, but of course, something is going through your body, so it's just going to be a little inconveniencing for that moment.
Okay. So specifically, what do we use the TVS for?
The TVS or the transvaginal probes examination, just as I said earlier, you can use it to examine a lady that